So let's talk about the Zika virus. Is this just the latest disease scare of the 24-hour news cycle, or is it something we really need to worry about? Well, it is something we should know about, especially for those traveling to Central and South America, for pregnant women because of the associated birth defects. And the story is not going away, considering the Summer Olympics are in Rio this coming August. But this is also the kind of thing that could lead to unreasonable fears, at least in parts of the country not directly affected. So that's why we went to see Dr. Alexander Garza, Associate Dean of Public Health Practice at St. Louis University. And from 2009 to 2013, he was the Chief Medical Officer for the Department of Homeland Security. He knows about this stuff. You may have seen him talking on CNN about Ebola. But today, everybody's talking about the Zika virus. Frankly, it's something most of us never heard about before. Right. And then all of a sudden, it's there. I mean, was it always there? And is there some change, some mutation, some environmental thing? What happened? Why is it emerging the way it's emerging right now?
Yeah, so there's a couple of theories about that. So you're right, it has been around for quite some time. It was discovered in 1947 in Uganda in the Zika forest. That's what it's named after. And it led, eventually it was an infection in the primate population, so in chimpanzees and monkeys, and then for some reason made the jump to a human transmission.
That's not uncommon.
No, not at all. The majority of diseases that we suffer as humans have come from the animal kingdom, and so that's not uncommon at all. And so, the virus has eventually, though, migrated from Africa along the South Pacific into Tahiti, French Polynesia, and then eventually made its way into South and Central America.
So you were the Chief Medical Officer for the Department of Homeland Security, right?
Yes.
So tell me a little bit about when something like this emerges, whether it's Ebola or H1N1 flu. How does the government react? How does it marshal its resources to respond to this?
Right, so when big instances like that occur, it's an all-hands-on-deck sort of moment. And so during H1N1, I was fresh in the federal government, and that's exactly what it was. It was marshaling the resources from the CDC, really all of HHS. Homeland Security was heavily involved in responding to H1N1. As well as, federal agencies that you wouldn't necessarily think about, so like Department of Education, because if you remember back at that time, there was schools that were closing, and then there's other effects that happened from that. So there was a wide variety of federal agencies that come together to respond to incidents like this.
There's a lot of moving pieces in this.
Incredibly, a lot of moving pieces, yes.
Here's the other issue you deal with, and that is how much information, how do you educate the public without creating a panic?
That is always a difficult equation. On the one hand, you want the public to be aware that this is an issue. You don't want to message it, though, so that they become anxious or that they become paranoid or that they become, overly reactive to what's going on. And in some instances, we've seen that. For instance, with Ebola, where there were quarantine measures getting thrown up, really that weren't based on scientific fact.
Yeah, there's a couple of things. One is the immediate response. What do we do at the borders? What do we do with testing? What do we do in hospitals? And then there's maybe a longer term, which is where do we start putting money to find preventions and cures? Is that part of this as well?
It is. Sometimes that gets lost in the shuffle, though. I think it is.
We want a cure right now.
Exactly. Yeah. But so we're a very reactionary society, though. So we usually wait for something to happen before we react to it, and then we put a bunch of money, put a bunch of effort, put a bunch of people into finding the solution. So the vaccine, then. Same thing happened with Ebola. Same thing happens with H1N1, and on and on. But I think that is then a good table setter to say we live in a global society. There are emerging infectious diseases that occur around the world. And so it is, for us, it's more beneficial to take care of those problems while they're emerging in other countries, in other areas of the world, than tackle them at home, because it's much more time-intensive, expensive, causes a lot of anxiety in the population, all of those other things when we have to deal with it inside of our own country.
One of the questions that comes up is climate change. Would you expect to see more or different kinds of health issues like this because of climate change? I mean, we're getting, armadillos are moving further north, fire ants are moving further north. Will certain diseases be moving into areas where people aren't used to having them?
I believe so. We've already seen some of that come about, presumably due to climate change. And the disease patterns that I learned about in medical school 20 years ago plus, where certain vectors would live in certain parts of the country because of the climate. The patterns are now completely changed. Not completely changed, but they're certainly emerging, right? So before we saw disease patterns for Rocky Mountain spotted fever or Lyme's disease, which are both carried by ticks, and they lived in certain parts of the country. And now those patterns are starting to change. The mosquito population is similar to that. The Egypti mosquito lives in the southern United States because it needs a warm environment. And so for practical matters, if the environment is warming, it's going to start migrating north as far as it can.
I'm thinking either high school history or biology class. The Egypti mosquito is the yellow fever mosquito, right?
Correct. It transmits more than one.
This is one dangerous mosquito.
It is, right? Right, and I think one of the questions then is, and something that I think is going to get debated during this outbreak of Zika is, particularly with some of the countermeasures that are being used now. And so one of them is genetically modified mosquitoes. So it's a genetically modified male mosquito that's unable to produce offspring. So then you get sort of into this theoretical discussion. So would it be acceptable to eliminate a life form such as the Aedes aegypti mosquito that can devastate populations with viral disease? And the way that I was thinking about it before is, well, we've done this with other viruses such as smallpox, right? We're attempting to do it with polio, eradicating the virus from really the face of the earth. Is it now plausible, is it acceptable to remove the vector or the vehicle that transmit the virus, such as the Aedes aegypti mosquito? And there's plenty of other mosquitoes out there. Do we really need this one form of mosquito? I think that's an interesting question.
So as the spring and summer approach, we probably would have good reason to limit mosquitoes' growth anyway, whether it's West Nile or Zika, which I'm thinking I probably have more to worry about West Nile than Zika, but that's just me.
Right, right. So it's a very well accepted public health practice, right, to limit vector or limit transmission from mosquito-borne diseases, no matter if it's chikungunya, yellow fever, Zika, malaria, West Nile. And how you do that is you decrease the population by making sure that they can't breed. I mean, this has been a tried and true practice. I was speaking with some students earlier today, and I had to explain to them who Walter Reed was. And Walter Reed was a famous Army physician who discovered that yellow fever was transmitted by a mosquito. We couldn't dig the Panama Canal because people kept getting sick. He removed standing water. They were able to complete the canal. So it's those sort of simple public health measures that we should be doing every day, regardless of if there's an outbreak, in order to control that population. Always a good thing. It just has renewed or more emphasis now because of this infection that comes along with it.
Yeah, great. Dr. Alex Garza, thanks for joining us. Appreciate it.
Thank you. Appreciate it.